dear colleagues and partners, on behalf of UNICEF Regional Office for Europe and Central Asia, WHO Europe, ESA, and the Initiative Health Systems for Early Childhood Development, it is really my pleasure to welcome you all today to this webinar. We will talk about the effects of war and displacement on young children and their families from Ukraine, and the challenges and issues, but also good practices that are related to the provision of holistic support for health and development in Czech Republic and Ukraine. And now, first of all, I would like to bring your attention to a couple of technical points. If we can go to the next slide. As you can see in today's webinar, we have translations in English, in Ukrainian, and Russian language. So that said, please choose the language of your preference by clicking this little planet icon that you see at the very bottom of the Zoom frame. I would also like to encourage everyone to turn on their cameras if possible, because we really enjoy seeing faces, and there will be plenty of opportunities to interact during the Q&As. And also, please feel free to share any questions that you have, any reflections and comments in the chat at any time during the webinar. We will try to address them also during the Q&As. So today we have a very exciting agenda that you will see on our screen in a second. If we go to the next slide, please. So we have two country presentations that are covering the importance of supporting health and development of young refugee children in Czech Republic, and also how home visiting has been used as a platform to deliver essential primary healthcare interventions in Ukraine. This will be followed by an interactive panel discussion on the benefits of home visiting. And we are really looking forward to really benefit also from your participation in the webinar. So I think we are ready to open formally the webinar and start with the welcome notes. So I would like first to invite Gabriele Fontana, who is our Regional Advisor for Health at UNICEF Regional Office for Europe and Central Asia, to come in and to open the webinar with the first welcome note. Gabriele, are you with us?
Thank you, Sanya. Yes, can you hear me?
Great, yes, we can.
Perfect. So, colleagues, it's a pleasure today of greeting everybody on behalf of UNICEF and welcoming us all to another webinar hosted by the Health Systems for ECD initiative. It's great to provide these opening remarks jointly with Martin Weber from WHO Europe. And it's nice to see our colleagues and friends in Ukraine on the camera there in their conference room. As we all know, the escalation of the war in Ukraine resulted in Europe's largest population displacements since World War II, with almost 6 million refugees, of which 84% are women and children. And in addition, we have an estimated 5.1 million people, of which 1.3 are children, that are currently displaced within Ukraine. Humanitarian emergencies involve multiple risks for the development and well-being of young children. Young children and their families have often no access or face additional barriers to basic healthcare services and social protection safety nets, which are essential for sustaining health and adequate nutrition status and development. So today we are gathered to reflect on how we can support early childhood development during a health emergency and during a health emergency response led by national health systems, looking at the experience that was matured supporting young children and their caregivers affected by the war in Ukraine. Science tells us that the development and resilience of all young children depends on the quality of the relationship and responsive interaction with their caregivers. In emergencies, however, many caregivers face elevated level of stress, coping with insecurity, traumatic experiences, isolation, and therefore are often not able to attend to the developmental needs of their children. And when moving to a different country or even to a different area in the same country, support may be disrupted or not available for prolonged periods because of legal, administrative, cultural, or language barriers. So to address these challenges, many countries in Europe activated a temporary protection directive enabling immediate access to healthcare for refugees fleeing from Ukraine. Several initiatives were mobilized in national and local health systems addressing the health needs of Ukrainian refugees, and platforms were created to inform them of their rights and on where they could find services. Despite great efforts from the hosting countries and entitlements to equal access to health care for refugees, many Ukrainian refugee children and women faced and are still facing barriers to accessing health care. Now, sustaining primary health care and adapting it to address the holistic needs of children and families, including health, immunization, mental health, parenting, and child development, is critical to reduce the impact of war and enhance the resources of caregivers to provide nurturing care, including mental health. Now, to support countries' efforts in this regard, UNICEF, in coordination with WHO and other agencies, financed intervention through the national health systems to support health response in Ukraine and in hosting countries. This has been done in collaboration with ministries of health, municipalities, providing often assistance to health institutions to sustain primary healthcare services, expanding on vaccination, young child feeding, early childhood development, etc. Now, during this period, needs and opportunities for collaboration went beyond primary health care, as children needed specialized healthcare services, including early interventions provided to children with developmental difficulties. I would like to congratulate the Minister of Health of Ukraine and the Minister of Health of the Czech Republic and other partners for their great work and efforts in ensuring that all children have access to quality health services. And we look forward to hearing more about your work and experience during this call. I hope, and this is, I think this is an opportunity, this call is an opportunity to reflect on what was done, what worked, what are the remaining challenges, so that we can inform our future efforts, not only in these two countries, but in many other countries from which colleagues are joining and listening in, to better respond to the needs of refugee children and families. Thank you so much.
Thank you, Gabriele. So it is my pleasure now to invite Martin Weber, who is the team lead on quality of care and child and adolescent health from WHO Regional Office for Europe, to come in, address the participants, and deliver the second welcome note of today.
Thank you very much, Sanja, and thank you very much, Gabriele, for setting the stage already. I can be very brief because Gabriele has said most of it already, what is needed for the opening of this webinar today. For those of you who are regular participants in it, and I guess most of you are now, you know that we have used this joint initiative between UNICEF, ISA, and WHO to really promote early childhood development across the whole of Europe. We have done this under more regular circumstances, and we know that in many countries it's difficult enough to promote early childhood development because it's just not very prominent on the agenda. When we are talking about crisis situation, it's even more so. So we are looking forward very much to the exchange today from Ukraine to the Czech Republic, how this can be done in crisis situation. It's probably carrying colts to Newcastle or owls to Athens, as the saying goes, to this audience to say that this is a right under the Convention of the Rights of the Child, that every child should be entitled to the best possible development. And of course, this also holds in crisis situation. The devil is in the detail, and I think we will learn a lot about it today. We will discuss in between stationary facilities and outreach facilities through home visiting, because both of them have got their advantages in this sort of situation. And as Gabriele was saying, the essential then is also to link it up to the referral pathways. The entitlements in most of the European countries, in the countries of the European Union, are there already. It's a message to give over to the parents. I just want to highlight again, most of you know it, we have the pocketbook of primary care for children and adolescents, which is the backbone of service provision. It has been translated into Russian and, more importantly here, into Ukrainian. And many of the messages to parents are directly there addressing parents. So if you are a care provider and you want to have a download of messages, you can use them directly. Let me conclude with the warning which we are seeing on the wall. When we had the COVID outbreak before, with the lockdowns, early childhood development was the biggest victim. Policymakers saw infection control very prominent, and early childhood development was something of less immediate concern. It was pushed back because the effects you see much later. We have to make sure in this crisis situation, both in the refugee setting and in the emergency setting in Ukraine, that policymakers are not making the same sort of mistake again by postponing everything on early childhood development and focusing more on acute trauma care. That's obviously what we are coming together today, and I'm looking forward to a vivid exchange of the experiences. Back to you, Sanja.
Thank you, Martin. So as Gabriela mentioned, there are multiple risks during emergencies that are coupled with these challenges that we see in terms of accessing important services such as health. And Martin mentioned as well, we know that young children are the most vulnerable population in conflict settings. So the next part of the webinar is really bringing experiences from Czech Republic. So let's hear how they tackled this challenge, how they were integrating new programs to support health and development of young refugee children and their families. And we will have 5 minutes time at the end of the two presentations for Q&A. So I would like first to invite Sara Kremelova, who is a focal point for Ukrainian refugee response at the Ministry of Health, to present on how the ministry actually responded to the needs of young refugee children and their families in Czech Republic. Sara, the floor is yours.
Good morning, everybody. Thank you very much. I hope you can hear me well and you can also see the presentation right now.
Yes, we do. Thank you, Sara.
Okay, thank you. So once again, good morning, everybody. My name is Sara. I'm currently working at the Ministry of Health here in Prague in the Czech Republic. And thank you for this opportunity to introduce briefly our work since the beginning of our conflict in Ukraine. Also, you can see my contact here, so please reach out to me anytime if you have any questions or if you would like to discuss anything more in detail. I would like to start with the overview of humanitarian emergency response here in the Czech Republic. So refugees that are coming to the Czech Republic, they are provided with the temporary protection status. That means that they have free public insurance here in the Czech Republic, and it is divided into two groups, let's say. First one is public health insurance for adults that is free for 5 months, and there is unlimited public health insurance for children and elderly. All refugees also have free access to education, to labor market, and there are many organizations that help them with finding the accommodations. As you can see, since the beginning of war conflict in Ukraine, we welcomed more than 500,000 refugees from Ukraine. And then the Czech Republic decided to do something what we call re-registration. So refugees had to fulfill the request for prolongation of the temporary protection status. So as of April 1st, we have something more than 300,000 refugees here in the Czech Republic. And of course, the number is quite higher today. But as you can imagine, it's a huge challenge for the healthcare system. And we had to deal with this challenge, which I would like to continue with. So we started the partnership with UNICEF, which was really quick and fast, and the cooperation was really amazing since the beginning. And we established a work plan in August last year, and we identified the main areas that are really important for the Ministry of Health and also for refugees. And we started with all partners that are included in the project, the cooperations, and all project has started. As you can see, we have 6 main areas. The first one, which is probably the most important, is the access to primary healthcare services and vaccination. We started cooperation with 6 hospitals. 3 are university hospitals in one of the biggest cities in the Czech Republic, and 3 hospitals are on the regional level. And we established outpatient centers for adults and for children. Which is quite unique because usually we don't have primary healthcare centers in hospitals. But as there were many children without pediatricians, many adults without GPs, we had to come up with some really quick solutions. And there were hospitals that were really interested in this project. So UNICEF supported them with the financial support of salaries for doctors, nurses, and administrative workers who translate everything when there are like patients from Ukraine and they don't speak Czech. So there are always people who can translate everything. And beside the hospitals, we also started cooperation with the associations of pediatricians, and they strengthened their work capacities. So they extend working hours. Also, some doctors who already retired come back to work and started doing their job again because they wanted to help the whole system, the refugees, and of course, the children. So this is the first area. Then we also started working on the integration of Ukrainian healthcare professionals. So there was the opportunity for them to take the language classes that were focusing on the healthcare terminology and the language in general. So basically, they could join the healthcare system and help the refugees as well with the translation and with the providing healthcare services. Also, we started the vaccination campaign because there were like many people from Ukraine that were not so familiar with the vaccination, and there were some hesitancies. So we wanted to help them with the education and with the access to the primary healthcare, as with the access to the vaccination as well. Then we have the really big project that will be introduced later. It will be the presentation after mine. So I will give this opportunity to Dr. Nedla, who is responsible for this project. And also we had the program that was focusing on HIV, let's say, education, and it was held in schools. Here, as you can see, there are like some results. So we were able to provide healthcare services to children and women. It's more than 47 100,000 people. Also, many children were already vaccinated. We have almost 800 Ukrainian healthcare workers that were enrolled in the capacity building courses. We had many people that were educated about the vaccination. So we think that the whole project or the cooperation with UNICEF is quite unique, is quite successful. And I'm here for you just to answer all questions that you might have. Thank you.
Thank you very much, Sarah. And it was great to hear, and also very nice to see the photos from the field visits and see how ministry is engaging in Czech Republic. So second, I would like to invite Mari Nejedla, who is the head of the Public Health Support Center at the National Institute of Public Health, to present on how they are supporting Ukrainian refugee children and their families through public health mediators. Mari, are you with us? The floor is yours.
Thank you very much. Thank you for my presentation, Vera. Good morning, everybody. Thank you for the opportunity to share with you the results of our project called the Mediator for Health Promotion. It means a worker who provides education about primary prevention to the target group and increases its health literacy, availability of medical care, and therefore reduces health inequalities. In addition to the effect on the health of the individual, this is also economical advantages for society. Please, thank you. This is...
Mari, sorry to bother you, just to mention that we are seeing two slides at the same time. So it would be great if you can swap the view. Great, thank you.
Yeah, thank you. This is advertisement for position of mediators for health promotion. It was translated in Ukrainian language. Sorry, it's in Czech language. And also structure of management of whole project. At the top of the page is my position of responsible person for managing a whole project. The second level is professional team of my colleagues, health professionals who created 30 interactive programs, primary prevention, and next to them is a national coordinator of this project. She speaks Ukrainian and also Czech languages. She's native Ukrainian. We planned for project, so one national bilingual coordinator, next level, 20 bilingual health promotion mediators, and 75 Ukrainian spoken mediators, so that we can reach tens of thousands of Ukrainian children and their caregivers for primary prevention. These mediators of health promotion became employees of our organization for the duration of the project, for 1 year. They are employed on the basis of an agreement on the execution of work. It is a variant of employment legal relationship. They are paid according to the actual number of worked hours. It is also an opportunity to quickly employ people who are not from a member country of European Union. Please, next slide. Thank you. In this picture, you can see 4 regional Ukrainian coordinators in red color and a lot of Ukrainian contact trainers, so mediators of health promotion. They are distributed irregularly, depending on how many refugees there are in which region. The biggest challenge was ensuring Ukrainian mediators, because there is big traveling in this group to Ukraine and back. Next challenge was also borrowing models and tools It was administratively difficult from our institute. They need to come personally, and we used handover protocols. The method of interactive teaching of programs is also new for health professionals, so they learn not only primary prevention, but also didactics and an interactive way of communication. Please, next slide. Each health promotion mediator has completed training in 30 intervention interactive programs, which were created before in other project. And in this project, the programs were culturally adapted by Ukrainian mediators and translated in Ukrainian language. Training was partly online and partly face-to-face because we have a lot of models and ads for explaining prevention. Training of one program lasts approximately 1 hour. In mental health support programs, my colleagues used courses offered by National Institute of Mental Health and also UNICEF to update our programs, because mental health is not the main work for our institute. The programs are focused also on the psychological development of the child, education and positive parenting, methods of communication, also support of vaccination, healthy nutrition and breastfeeding, and improving of availability of registration at pediatricians. They communicate directly with doctors or with desk of health insurance company. The mediators please, next slide. Training was in 2 levels. The first one was training of trainers who trained second level, so-called contact mediators. After that, they can start to educate through interactive programs children and their caregivers. At this moment, we have 63 addressed refugees, children and caregivers, and we are approximately in half of project. So it seems we achieve planned numbers. We have a very detailed system of evidence. In this picture, you can see planned and achieved number of peoples divided according topics. The most difficult is ensuring vaccination, because it's not easy to look for doctors and persuade parents for vaccination of children. Please, next slide. In this picture, you can see the similar system of structure for Czech Roma people. We have some structure from previous Czech project funded from European Social Fund, and we used these employees also for this project, because they are from social excluded localities where the Roma people live, and they know the environment there, they know people, they know families, and it is very, very useful for communication between or among health mediators and Roma people. So it's the same structure, planned our numbers and situation by end of July. So please, next slide. All information about programs, about planned programs and activities are also promoted on social nets and in Ukrainian medias and newspapers. Please, next slide. The part of interactive programs are also a lot of leaflets. This is sample leaflets for pregnant women, for healthy nutrition, against consumption of alcohol, and so on. And we have much more leaflets in Ukrainian languages. It will be available after end of this meeting. Please, next slide. So, and now we continue with advertising for position of mediators for health promotion. We continue with the whole project to the end of January next year. So please, next slide. Thank you very much for your attention. And there is a contact for me in. Thank you very much.
Thank you very much, Mari. I think we already have one question in the Q&A, which is related to your work. And I will just read the second part because the first one you already answered, the main functions of the health mediators. But the second one, and very quickly, in a minute if you can, what were the main challenges you faced when developing the program?
Yes, one of the main challenges was to have contacts, to start with the first contacts with Ukrainian refugees, health professionals. It wasn't easy to start and to persuade them to work for our project, to educate them, and to educate them to use also, or not only to teaching, but also to use interactive activities using a lot of models, using didactics with communication with target groups. And of course, some barrier or some challenge was also that the Ukrainian refugees go back to Ukraine, especially during summer, and sometimes return back, sometimes somebody not. And we need to have more and more next people for this work. But now we have a relatively good team of 60 mediators of health promotion, and we try to have more this moment.
Thank you, Mari. Could I invite you and Sarah as well to please reply additional questions that are arising in the chat, because I'm aware of the time and I think we need to move forward to the second part of the webinar. But it has been really a pleasure. Thank you once again for joining us and for your great presentations that really allowed us to better understand your in-country efforts. Thank you again. So now we are starting with the second part, which will be focusing on the emergency response in Ukraine. And I would like to hand over to my dear UNICEF colleague, Igor, who is in Ukraine, or Ihor, I'm sorry for that, who will be moderating the next session. Ihor, please come in. The floor is yours.
Thank you so much. Thank you so much, dear Sanya. Can you hear us?
Yes, we can hear you very well.
Супер. Доброго дня, колеги. Я буду говорити українською мовою.
Good afternoon, dear colleagues. I'll be speaking in Ukrainian. So, heartfelt welcome from Ukraine and greetings from Ukraine. We've gathered here in UNICEF office. We've got sort of a family atmosphere, and allow me to introduce our host. So Yegil Superbeko, Dr. Yegil Superbeko, he is the chair of the section for health and nutrition of UNICEF in Ukraine. And also we've got Dr. Olga Ivanova, she's a pediatrician from the Center for Primary Medical Support of Kiev. She's part of our project. Also, we've got a family, Oleksiy and Katerina Malinovsky, and our main hero, he's next to us, Levko. Levko is 2 months old, right? Yes, he's 2 months old. And also we've got a nurse, a family nurse, who has been involved into one of our programs, Marina Barinova, and we've got a medical director of the Center for Primary Medical Help in Bucha from the Ministry of Health, Ms. Zhanna.
On our side, we'll start discussing about the experience in Ukraine, about the programs that we started at the beginning of 2022, when we just started the full-scale invasion, and the dynamics and the priorities that both UNICEF and the ministry have in the process of recovery and development and facilitation and strengthening of this sphere. So now to Aidil Superbekov. Thank you, Ihor. Greetings from Ukraine.
I will continue in English because unfortunately my Ukrainian language is not so great, especially when I speak, but I do understand everything in Ukrainian language. So my name is Aidil Superbekov. I'm the Chief of Health and Nutrition section here with UNICEF and in Ukraine, in Kiev. I'm very glad to welcome our guests from Bucha, including our key guests and speakers, the family from the town of Bucha with the fantastic, cute little kid who is sleeping. And well, I think he should be sleeping. So just a few words about the home visiting program in Ukraine and how do we work jointly with the Ministry of Health, with the National Health Services of Ukraine, and with the local health authorities in different parts of Ukraine on introduction and implementation of a home visiting program. Unfortunately, Dr. Arabina, who was supposed to be here from the Ministry of Health, had some other engagement with the Ministry of Finance. I hope she's speaking to the Ministry of Finance about financing the home visiting program. So that's why we excuse her for not being here. I'm going to talk about briefly about the history. So the home visiting program, which focuses on the first 1,000 days of life of a child from conception until the child turns 3, started in Ukraine a few years ago. It first started in 2020 in eastern part of Ukraine, in an oblast called Donetsk, which is part of which is currently, unfortunately, under the Russian occupation. And unfortunately, at the beginning of the war in 2022, this program had to temporarily stop. So because of the huge humanitarian needs in health sector, we paused the program at the beginning of 2022. However, towards the end of 2022, we resumed the implementation of the program not only in the eastern part of Ukraine and in some areas in central Ukraine, such as Zhytomyr, Chernihiv, but we started to expand the program to other oblasts, other regions of the country, and also focusing on the areas that were directly at the front line or in the newly liberated areas where the Ukrainian forces moved down the Russian forces. And there were a lot of needs for bringing the primary healthcare interventions to every Ukrainian family. So we use home visiting program as our mechanism to bring the primary healthcare interventions to the homes of every Ukrainian child and every Ukrainian families, mothers and fathers and caregivers. And we're doing it jointly, as I said, with the Ministry of Health, National Health Services of Ukraine, Public Health Center, as well as our international partners such as WHO, World Bank, and others. And we use home visiting program is our modality to deliver on early childhood development interventions, especially as we develop our new country program of cooperation between the government of Ukraine and UNICEF for the next 5 years, which will start in 2025. I just wanted to say that for the moment, we have scaled up this initiative from a couple oblasts to 8 regions of the country. So far, we have around 500 healthcare workers that have been trained on home visiting program and delivery of ECD interventions at the primary healthcare level. And we can demonstrate the dashboard. I think Igor is showing the dashboard of where the program works in the country. As you can see, it's not everywhere, but it focuses in the areas that, as I said, are close to the front line, such as Kharkiv and Dnipro, as well as in the central part of Ukraine and in the east of Ukraine, where we have a significant number of internally displaced population that came from the eastern part of Ukraine. So we, with that, we covered that. That population. I think home visiting program and especially the delivery mechanism for home visiting program is a great way of humanitarian development nexus, as a concept that my UN colleagues are very familiar with when we try to use the humanitarian funds to strengthen the health system, not only for the short period of time when emergency is there, and hopefully we will reach, the Ukraine will reach victory very soon. And but we try to make sure that whatever we provide and whatever the resources we spend stays in the country even after the emergency and serves for the people of this great country. So this is number one. I just wanted to also to say that we're supporting the Ministry of Health and the health institutions with very few things here in Ukraine. Ukraine has a quite developed healthcare system and a network of healthcare facilities at different levels, at the primary healthcare level, at the secondary level, and at the tertiary level. For the moment, the healthcare system is ongoing some of the reforms, and I think our contribution to jumpstart the home visiting program with the supplies that we provide, such as home visiting nurse kits, the materials for the families, as well as transportation means for the nurses and some other equipment for the health facilities, as well as making sure that the health facilities where the parents can come are conducive for children. We do rehabilitation of immunization rooms, of home visiting nurse rooms, etc., as well as the capacity development of home visiting nurses and doctors. So those are the main contributions that UNICEF provides the Ministry of Health with, and the rest is done by our fantastic teams of nurses, of home visiting teams, which includes nurses and doctors, of course, but most importantly, with their advice, our families, Ukrainian families, are able to help themselves and their own children to achieve the full development that every child has a right for, to successfully also bring Ukraine in achieving the sustainable development goal on goals on health and eliminating hunger. So with that, I think I'll stop here. We will continue as a UNICEF to support the Ministry of Health and all the national health authorities, including the authorities on the ground, with scaling up of home visiting program. We have, like I said, so far reached around 3,000 families and all over Ukraine. We have done a small satisfaction survey that reached all those families, and according to the satisfaction survey, I think around 95% of those who were asked, they are quite happy with the services that they received from the healthcare system, and they would like to continue to receive such services even after the child is has reached the 3 years of age. So it is a great support to the family. It is a great support, especially to young parents, to navigate the first days after the child is born, because sometimes the parents are the first time parents, they need support, and especially during the war, when they are far away from their grandmothers, grandfathers, and the big extended family. This support is very needed. So with that, I would like to thank our fantastic healthcare workers, our families in Ukraine, as well as our partners in the Ministry of Health, in WHO and other agencies that support the implementation of this program and will continue support the implementation of this program during the recovery of the health system in Ukraine. Thank you so much, and I'll stop here.
Дякую, Айгіль.
Thank you, Aigil. Before we move on to the more practical discussion of experience exchange, I think we should watch a short video which we made specifically to show how our nurses work, in which conditions they work, and which benefits our families receive from that. Can we turn it on, please?
Пологовий будинок, були бойові дії.
Мені
потрібно було виїжджати
and
перше,
I had to
попавшися в
leave
місто, щоб
in the first city I could get,
появилась дитинка на світ.
so that I could give
Ми
birth to
тут
my
залишилися,
child.
живемо вже рік.
So we stayed here. We have been living here for a year in Pavlograd. The doctors are really great,
переживаю за
and
здоров'я своїх
they
дітей.
help us a lot because I worry about the health of my children a lot.
Медсестра час приділяє
The nurse
тільки дитині, а й
just spends time not only with the child but also with the mother, and talks to the mother, discusses after labor, because some of them are stressed because of the war. There's missiles, there's shelling. Thank you for this video. We have a whole series of such short films. I think we will share in the chat so that you could watch them and to see which aspects, which problems we work with specifically during the visits. These videos, these materials, they will also be presented at the conference that we're going to have in October in Astana on primary healthcare. And I think that this experience, these emotions, and these achievements, they should be useful for other countries that potentially could also take something from our model, from our experience. Now I'd like to give the floor to Жанна. She is from the primary healthcare of Bucha, is the Kyiv region. And the question is rather simple. Can you tell us about how you made it through this program, what you received as the head of the department or your center, and what your perspectives are? Good morning, everybody. I'm Жанна Limchuk. I come from Bucha Center of Primary Healthcare. First of all, I'd like to thank for being able to participate in this project, and I can now present our experience. I'd like to say that our city, the city of Bucha, our community, because community includes also 8 smaller villages around Bucha. Since the first days of the full-scale invasion, they were in occupation, under occupation. And of course, this was a very difficult time for the people, for healthcare workers who stayed there to provide services. But when we came back after the occupation, we understood that people really need help, need aid, need care. Believe me, we had people and families who for months didn't even go outside because they were so afraid of this rough occupation regime. And thanks to this project from UNICEF as home visits, we found out from Facebook, we saw experience of other regions of Ukraine, and we were invited to participate in this project. We had a training of 2 teams of medical workers, doctors and nurses, who received some practical skills, they improved them, and this is how we started working. As of now, we provide service to 21 families in Bucha community. At the beginning, it was a very interesting project because not all families understood why this is needed. If you have your own doctors, if you have nurses, you can also provide this service. But gradually, in the last month, we have seen that there's been a huge influx to this team of people who participate in this project. Our nurses, after the training, managed to update not just their knowledge and skills in breastfeeding, vaccination, care, but most importantly, they managed to create a group of peers amongst themselves, amongst nurses, and to share experience in our center, to provide recommendations, to conduct training, to exchange their knowledge. We changed financing for the facility for our nurses, so this is also a stimulus for them in the work. As regards our parents, we also conduct an analysis of, or we have a Facebook page where we make announcements about this project. We always try to get feedback from that. And really, the families who are in this project, they are very happy because they receive information both in leaflets, in handouts. Support also continues. Unfortunately, the war is ongoing and it's very tough, and it's very important for the parents, for the mothers, for PTSD and post-labor depression. So the support for the mother and the baby during the air raid alarm, because it provides to having proper socio-emotional condition and support breastfeeding. Also, very positive in the work of nurses was the use of telemedical equipment that we recently received from UNICEF. We gradually implement this, and today our colleagues just shared this experience that all doctors could join, and we could provide feedback because it facilitates the work of the doctors and our nurses who work in remote areas, because the area of Bucha community is quite big. Of course, we expect to get more. We know that UNICEF will help us because we're working on that. It's the vehicles, because getting to more remote villages, this is also something that must be done in order to provide high quality care. Now we continue learning. We hope that this project will continue in the future, and we will be able to teach other teams of healthcare workers to provide this kind of aid. And we hope that together with international organizations such as UNICEF, Ministry of Healthcare, for the next year, this is going to be financing of this project, because really support of UNICEF is huge, but very important that a lot of financial issues, they end up with the facility. And since the legislative grounds is changing for care to children up to 3 years old, so now we're at the stage where we have to develop it. And I think I'm a doctor, pediatrician myself. I work with the children, so it's this universal progressive model, home-based model, it's really relevant, so that in the future we could bring up a healthy nation of Ukrainians. This is very, very important for us. Thank you, Жанна. Thank you so much, Жанна. Olha, you as a pediatrician, usually we have the category of doctors, family doctors, who say, well, the model is really very good, the program is great, excellent, but this is going to be the competence of an unhealthy competition, yes, between nurses and doctors, because nurses could take over some of the functions of the doctors, and sometimes the doctors are worried about that. What's your experience? What's your impression how this link is working? Greetings, I'm Olha Ivanova. I'm a pediatrician of the Center of Primary Healthcare in Kyiv, Podilsky district in Kyiv. And actually, what I'd like to say, we don't have and never had any competition with our nurses, because our nurses, they have separately we have 3 nurses in our facility who have education of the nurse, who have background in nursing, but they can also receive, they have and provide, have skills too, and they provide psychological support to families. How this communication is happening? We have 47 families in this project, and there's never been, as I see, there's never been any competition. The workflow, there's a lot of IDPs, so there's a lot of people coming and requests, and sometimes the doctor just physically doesn't cope when they have like just 20 minutes per patient to provide all the information. So some of the duties I will happily delegate to my colleagues, because we have cases and diagnoses where we need additional home visits. In this case, even we have example of our family where the boy was born naturally, and when he was breastfed, he was not gaining in weight. So, and there were cases also when mother would be concerned that sometimes maybe milk is not enough, or why is he not gaining weight. So there was psychological support both on my side and on the side of Marina Hernadievna, where there were additional visits. We would also provide psychological support. We preserved this breastfeeding, and our boy is successfully now gaining weight. And also we have a lot of families that also suffered during occupation, especially from Borodyanka, where we have cases when they lost their homes. Also, we have many parents who are soldiers. Unfortunately, many people wanted to be present today, but not all of them could join us. Those who want to join us online from the front line, but we didn't experiment with that. So it's also very important to support such parents and such mothers. Our patronage systems are successful in that, and I am happy, because when I receive parents without information, with all the information regarding information,
and also when it comes to the benefits of breastfeeding and the other functions of our center. So we are successfully implementing this thanks to your support. And when we provide the reports on our families, most of them, the majority of them, all have been vaccinated, and most of them are on breastfeeding. And those who were against the vaccination, now they're trying to keep up and make up for the missed vaccination. So I'm really proud that our leadership and our center selected the people to our team who love their work, who are motivated, and there's no burnout. So I hope that we won't have any burnout in the future, and we pass on our love to our children. So thank you for this trust, and thanks to you, our coverage with vaccination has been increasing. And basically, that was on the tip of my tongue, this question about the indicators of vaccination, breastfeeding, and so on and so forth. So we're going to have this general analysis, but as a family doctor, as a pediatrician, you see this data for your patients. So how do you assess it? What has been improved? What hasn't changed? So there's been the improvement, first of all, in breastfeeding. So again, this is something successful, and when there were some moms who said that it's better to provide additional artificial some baby food, but our nurses, they try to convince these mothers that this is something extra. So they try to persuade that breastfeeding is good for the immune system, and of course it's good for the mothers and for the child's immune system. Also, when it comes to vaccination, so they not only the mandatory vaccinations, but they include additional vaccinations. There were families who were coming back to Ukraine from Europe, and they were vaccinated according to our main schedule. But when they came to Europe, they saw that additional vaccination is a good thing. And when coming back to Ukraine to their families, they continued with this additional vaccination. And especially during this telemedicine program, right? So we all doctors and pediatricians from Ukraine, we still keep in touch with our patients who are abroad, and children who had additional vaccinations abroad. So they were accepted to the kindergarten, to the schools right away, and the parents were very happy about that. And our nurses, they are all educated when it comes not only to the main mandatory, but also additional vaccinations. And they also are trained in providing psychological support and also in providing the emergency support. That's the word they can consult with. And also when we have home visits to the parents, we give them the recommendations on the emergencies, on the prevention of rhinitis. And so when there's some urgent issue and a nurse sees that the additional visit to a doctor is needed, so she makes this appointment, or if there's an online consultation needed, then again we use this device and during the appointment I can see where I can provide this consultation online or from the home visit. And basically there is no competition between nurses and physicians. We exchange information, we support each other, and our patients, our parents, they always can enjoy the support not only from the physician online, but also and first and foremost from the nurse. And this is like the family's best friend, basically, not only a physician, but also a nurse. And there are cases when, for example, there's a evening appointment like 8 or 9 p.m. or some emergencies when, you know, you have young parents and there's a small child, and basically the Ukrainian physicians don't have a some fixed schedule from 8 to 7 p.m. So we basically available to our patients 24/7, and the parents know that and know that they can count on us. And for example, our son Lev, he's 2-month-old, he's on breastfeeding, and we received our first vaccination, and now we received the planned vaccination against a number of children's diseases, including polio, and he tolerated the vaccination very well. And then we'll get the vaccination when he's 4-months-old, but we will definitely have additional vaccination against meningococcus. So that's what we have. Thank you, Ola. Now the floor is goes to Marina. So Marina, you are an experienced nurse and you've worked in the regular system and now you work in the new system, a new model, in the new project. So what has changed for you? So what changes have you felt? So hello, colleagues. First of all, I'd like to express my sincere gratitude to Czechia for accepting our families and provides all the necessary help there. This is very valuable for us for preserving our nation, and so my deep gratitude to you. When it comes to the new program and the project in Ukraine, we are very thankful to UNICEF that you're providing us this opportunity. And basically, this is a very convenient project for young families because we have the opportunity to provide not only medical assistance to the families, but also to educate the parents and mothers and fathers on how to take care of the child in the proper way, how to provide the correct kind of nutrition. We have the time to do this. We've got 1 hour or 2 hours to educate the mother, to demonstrate something, to calm her down, and to provide confidence to the parents that they're doing great and everything will be fine, and also to reduce this anxiety that parents may have. And we're very thankful to UNICEF that they provide assistance with telemedicine. These are very convenient devices which give us the opportunity to communicate right away with the physician if there is some kind of emergency. And yes, the thing is that our country now is at war. There's martial law in place, but we're trying to preserve our future and we're working for the sake of our children and for the sake of the future of our country. So when you, for example, have an appointment and home visit and, there's a number of families, what are the questions that you hear most often? What are the parents interested in? Yeah, there is a certain audience, right? And those families who are not covered by the project, they know about our service. And even pregnant mothers, they know us, they meet us, and they basically register for the future home visits, and the parents are very anxious about, like, like, for example, one question they have: what if I don't have enough milk? And then we start working with the mother. We try to calm her down. We try to bring her confidence. We show her the proper postures and the relaxation regime. And parents, especially fathers, they take part in this program. They're doing great. And all the families that I'm responsible for, like half of them, fathers, are protecting our country. They're in the military, but those who stayed, those who are not in the armies, they support the mothers. They give them time to take some rest. They give them time for themselves. And this is very valuable. And of course, parents are very anxious whether they would have a chance to vaccinate the child, because they know, the times that we're in, and we again try to persuade them that everything is fine, that us country and the UNICEF are trying to provide all the necessary vaccines to the country. And this is very valuable again. And all the parents, all the families that I'm responsible for, they are all covered with vaccination. So thank you a lot for that. But if to compare, for example, your family practice before the program, so to what extent basically has this changed? How has this changed? Has it become more interesting? The thing is that when I personally learned about this program, and when in May, I basically signed up for the training, and I told my director that yes, I do want this and I need it personally, because when I was giving birth to the child, that's something I was missing. And that's a very interesting project. And this is a very useful program and project. I like working with children when I can give not like 10 or 15 minutes to the family, but I just visit them, like friends, many of those families, when we can, there's a nice peaceful atmosphere, no one is rushing, we can discuss everything. And when we plan the next appointment, I always tell those parents that, come up with a list of questions that you're worried about. And I always tell the mothers that there are no stupid questions. And all the questions are important. And I answer all of those questions, sometimes a couple of times. And I'm always 24/7 available to the families. And I have an individual chat in the Telegram where all my moms and dads from these families, they're all in this chat. And this is where I just post some additional information. And I'm happy with my work, yes, and with what we have. So this is ongoing development. Yeah, and I have 2 degrees in medicine and in psychology. So maybe it's a bit easier for me to work, because I know a lot of psychological aspects and what is needed to the young mothers and to parents and to our nation in general. Thank you. We've got a couple of questions in the chat, but if I may, we'll just read them out at the end. We'll get back to this. So, Alexei, so how was it? So you were at home, and then someone calls you up and says, hello, I'm a nurse, and I'll, visit you tomorrow. Yes, I think this is the way it was, but my wife knows it better, how exactly it happened. May I give the floor to her? Yes, of course. Katarina, please. Okay, will you hold Levchuk? Okay. So please share your impressions. Didn't you have a wish to change your phone number, maybe, or to open the door? So what is your experience with this program? So that was a very interesting experience, because we didn't know anything about this service and what it is. And when the nurse came and together with the representative of the hospital, with a physician, right? And they started telling us about UNICEF. We were really surprised, because we didn't know about this organization, and we didn't understand what exactly we will need to do, because they said this is for free. You will just have a visit from a physician. He'll be in touch with you. It sounds, like fairy tale, because sometimes it's really difficult to have an appointment and, to visit the doctor, to go to the hospital. So, it takes time. It's a small kid, but now you have a nurse and tells you everything and helps you. And we were really surprised with the attitude, because Marina came with so much love, not only to the child, although this is extremely important, but also to the parents. So she was calming us down. She said that we are doing everything correctly, and we had no experience whatsoever, of how to raise a child, because Levchik is our first child. There are no sisters or brothers. So, of course, we went to, these preparation courses, but when you just leave the maternity ward and they're one-to-one with a child, sometimes you're in shock because there are a lot of details. And we have now we have Marina, and we have our physician pediatrician who is always in touch and always supports us. And this is extremely important when the physician says that everything is good and you're doing everything correctly, the physician and the nurse. So we're very thankful, because when looking at the child, when weighing the child, and Levchik was born with very little weight, and we were worried that maybe there will be not enough breast milk. And weighing, the procedure of weighing was, you're just anxiously waiting for this, whether the child is okay, and then Marina comes and then she says everything is fine. The child is developing correctly, so it's really important to learn. And this is really important for the child. So thank you so much to physicians. Thank you. And I'd like to add that we had there was a certain diagnosis, and basically we found our way to get to the specialized physicians and to agree the appointments. Yes, you have a great team, a nurse and a physician. They know everything about all, small problems, bigger problems. This is really great. And have you had, experiences when, there are a lot of things that you're very emotional, like, like the sockets in the wall are not secured or anything like this? Yeah, so any aspects like this. So when Marina came, she gave us a checklist where, there was everything, everything about the child's sleep, everything about the behavior of, how not to overheat, how not to provide, not to, to ensure that the child is in the comfortable temperature environments, to make sure that everything is comfortable for the child. Yes, Alexei, so what is your experience with this? Why is it important? So in Ukraine, the involvement of dads, of fathers, it's a very sensitive issue, because very often it's, there is some impression that the mom needs to be on the maternity leave and the dad needs to work and make money, and moms are more responsible for raising the children. And we're trying to address this and fight this, because indeed this is a very sensitive process, raising a child, and father is very important for a child. So how has your maybe worldview changed, or well, nothing has changed, and I'd like to say that no one doesn't owe anything. But if the thing is that if you decided to have a child together, then you are responsible for this child together, and the time that you spend on taking care of the child, it has to be from both sides, and at least you have to try to make sure that it's equal, at least. So what else can I add? And the thing is that this family is where both parents have been educated, and are very happy about that. And now we have more and more fathers like that, who not only support wives, not only support their wives, but they take a direct part in raising the child. So here we have 100% involvement of fathers in families like this. And I want to make sure that fathers always get involved in supporting and raising the child and helping the wife and taking part in everything when it comes to children. And let's say this program, like when Levchuk was born, so would it be useful if these visits were done before the birth, the process of planning the pregnancy? It would be good, of course, but when you start thinking about it and that you need it only after the child is born, actually, and then you start having the first real questions, you know. And if we take like top 3 questions that you had to Marina, top 100, not top 3, top 100 questions. Okay, so let me, yes, try to answer it.
First, it was interesting, like you just come from maternity hospital. Is the air temperature comfortable? Are the conditions comfortable for the child to be in the apartment? Marina told us that the air was dry, so we made it more humid so that it would be easier for the child to breathe, that the comfortable temperature is also an important factor. Then when we talked about breastfeeding, in the maternity hospital, we were told to add formula to the child because he was too small. And I was really scared that I could lose breastfeeding. So Marina told us how to properly breastfeed, how to make feeding comfortable, not just for the child, but also for myself. This was a very important thing. Then when we talk about walking outside, I think also it was interesting how to do it properly, how to dress the child properly. Because on the one hand, you sort of understand everything because you get ready. But then when he's there, you still think maybe it's too cold in the apartment, maybe he's hungry, maybe I'm not doing something properly. And this is really great when the nurse comes and says, everything is good, relax. Especially now, it's very, very alarming times now. And to give birth to a child in such times is really, really difficult. So when somebody comes and says that everything is good, this makes things so much easier. Thank you. We have 2 questions in the Q&A section. The first, Marina, over to you. What are the new qualities, the new competencies should the nurse have so that she could provide high quality function and service? First, this is training of the nurses that we receive thanks to self-education and thanks to the UNICEF program, because as Katya has just said, you sort of know everything theoretically, but sometimes these things, they sort of get ignored. So self-education is very, very important. And I, again, think that like when I went through everything, when I looked at all the programs, it's like after I just graduated from medical college, yes? So it's really good that there's enough time for the visit in this model. This is very important. And I don't know. And plus, of course, telehealthcare. This is really very, very good. A good innovation that allows us to work much better. Regarding the function now of the nurse, you know, this project, it even provided with this opportunity that the nurse would have more authority, because we used to have since like the old Soviet times when the nurse was just like an assistant, but now we see that here that the nurse is empowered because they have duties, they have responsibility, they can, you know, point out to these red flags when you have to inform the doctor. But basically the child up to 1 year old, 90% of the children of what could be done in 90% of cases could be done by the nurse. And I think that this project, it gives more confidence to the nurse. It is this kind of future that we could empower nurses more. Zhana, I have another question in the chat to you. I will reword it. If you look at the we can, you know, have an appointment with the doctor in the online system, and usually it's like 20 to 30 minutes. Yes, 20 minutes if you have an appointment with the doctor. So how much time do you have this for the nurses who go and pay visits? How much is just one visit? And if we have the question of the child development or involvement of the children, what is the proportion of this time could be there? Whether this depends on the type of the visit is performed first, second, or third. How do you plan that? Of course, the time is different because it depends whether this is primary, patronage, or secondary. Also, a lot depends on the experience of the parents, because if this is second-time parents, then they have some skills, so it reduces, the time that the nurse spends communicating with them. Of course, it depends on the condition of the parent, the anxiety of the parents, how much time is needed. So each visit is very, very individual. When I talk to my colleagues regarding these visits, it's at least 40 minutes. 40 minutes is the minimum, and get feedback, understand whether they understood everything, the parents understood everything. And sometimes we had a visit, my colleague told me yesterday it was 2 hours, because in that case, in that specific case, they were looking at the skills of breastfeeding. And in order, because this is for the pediatrician and for the nurse, this is extremely important to give up this mixed feeding to breastfeeding. And she came to me with this, sort of achievement sense. You see, I managed to do the skill with the mother, but it took us 2 hours. There's a lot of different new digital solutions. Yes, mobile apps for the development of the child. UNICEF has a famous web app. What do you think about them? Do you think parents use during their routine life these apps? Yes, they use these apps. For example, one of the apps we have for me is something new. That the father installed an app on the phone where you could see from the cry of the child whether the child just wanted something or whether it was anxiety. But so for the father, it was very important that even had an app on the phone to understand how to respond to the fact that the child is crying. But in fact, there's different apps, and the apps that they have for the card for vaccination and the child development, so that they would understand the specific features. I personally, I had experience. We have a big group, milk rivers, we call this, where we try to keep breastfeeding for the women, and we teach them. It was 2 months ago. I saw that there was a request of a mother from Dnipro who had big problems breastfeeding, and she wrote very late in the evening, and I see nobody is answering to her, so I answered, and we talked to her for 2 weeks, and we set up breastfeeding for that mother. So yes, mobile apps, these are all very, very important things. Colleagues, we have just 2 minutes of time. We have to wrap up. We have 2 more questions. One question I will just tell you regarding organization of the training. If you would like to join this program, you can write to our address, UNICEF. You can email me or anyone from our team, and we will involve you in the next training. And the second question, very interesting to hear about home visits program, about preventive measures that are done within this program. But the question specifically regarding the children and rights of the children with disabilities. Children with disabilities, or with or parents or caregivers. How can this program respond to these needs?
Thank you so much for the question. I think it's very important. And like I said, we use home visiting program to deliver ECD interventions to every Ukrainian child. And every Ukrainian child means every Ukrainian child. So that includes, of course, children who unfortunately are either born with disabilities, or they have disabilities from different issues, including as a result of the war and occupation. And as our colleagues from Bucha can say, that there were few children who perhaps were impacted by the war. So the universal progressive home visiting model includes several blocks that a home visiting nurse or doctor addresses during the visit. And that includes also, how do they address the issue of disability? We have, like I said, just started this program in 8 oblasts, and one of the things that we are going to pay a little bit more attention is mental health and psychosocial support. The issue related to stigmatization of the families who have children with disabilities, not only in Ukraine, but I think all over the former Soviet Union. There's this kind of belief, if you have a child with disability, it's better not to show this child to your neighbors, and because it brings some sort of shame. So kind of stigma is attached to this. So I think one of the topics that we are going to promote a little bit later on is how do you address this issue? And it's not only also for children. We are in a country with active war. Unfortunately, also adults can be a victim of the war, of the unexploded ordinances, etc. And they may also be stigmatized by the society, by others. So it will also help not only children, but also the families, the fathers who come back from the front lines and may be subject to that. So I think this is number one. Number two is we are working also jointly with our colleagues from child protection sector that work on deinstitutionalization of the children. Again, this is a very unfortunate situation that has happened during the Soviet Union time, when children, even with a small disability, like for example, speaking disabilities, they were put in a special institution and a special care called in Russian language, it's called детский дом or internat. And we're now working together with the government of Ukraine to make sure that those children are taken out of the institution and are placed with either the foster family or the family that adopts them. And we are also aiming to, through home visiting program, to support these children, these families who receive the kids from the internats, and make sure that we work on overcoming their so-called temporary disability, be it a learning disability or be it speaking disability or any other disability. So this is number two. And the third element of the home visiting program that we are going to address is detection and management of disabilities within the family. So it may happen that a home visiting nurse may detect some signs, let's say, of children is not performing well for one reason or another, and that's together jointly with their doctors, they will find, as my colleague said here, they will find a way to arrange a special consultation, specialist consultation for this kid, so that they can early detect and develop a plan of action how to overcome that disability, so that child develops its full potential and have access to best possible primary health care active facilities and primary health care intervention through home visiting program. Thank you.
Дякую, дуже дякую, Айділь, дуже дякую, шановні колеги.
Thank you, Aidil. Thank you, dear colleagues. Sorry it took us a little bit more time. Greetings from Ukraine, and over to you.
Thank you very much, Igor. So we have reached the end of this webinar, and I hope you have all enjoyed hearing and learning from Czech Republic and Ukraine. What this webinar really highlighted is the need that health services support both the child and the parents, as the parents and caregivers are really the key and the main agents of child development in any setting, and even more so in emergencies. A big thank you again to all the speakers, and a special thanks to the youngest member of the panel, Lev, who has joined with us today and brought smiles to all of our faces, and whose future, along with the future of other young Ukrainian children, we hope to support through partnerships and through collaborations for a better tomorrow. So it was a pleasure having everyone today with us. And before we close the webinar, we would like to bring your attention to the next one that is happening on the 31st of October. And we will share the slide now with more information. I think we have it here. Thank you, Vera. But also, besides the webinar on the 31st October, you will receive, of course, the email from us inviting you. You also have here the QR code to subscribe to our mailing list and receive the newsletter and all the kind of exciting content that is being developed. Thank you very much once again.